Good morning. I'm Dr. Nishad, Chitnis, interventional cardiologist at the Heart Care Clinic in Kolhapur. And today, on the occasion of Doctor's Day, we're going to talk about cholesterol and the myths and facts surrounding surrounding cholesterol. First of all, you should know that our cholesterol levels are a very important indicator of our future and present heart disease. Higher the cholesterol, the more the chance of developing plaques in the artery, that is a buildup of fat and calcium in the artery, and the higher the chance of developing heart disease, disease of the disease of the limbs, and brain strokes. So when we are talking about the myths of cholesterol, one of the most important myths is that which many people feel is that I reach middle age, I don't need to worry about cholesterol. That is not true. Younger people are developing high cholesterol more and more frequently. So we should know our cholesterol at a younger age. And also there's this common myth that even if a person is young, even a high cholesterol is not an issue, is again not true. In fact, at a younger age, if you have a high cholesterol level, then you have that much more period of your life where you are going to be exposed to a higher cholesterol. So say you are 20 years old, by the time you are 60, you are exposed to 40 years of high cholesterol. Well, if you are 40 years old, by the time you are 60, you are exposed to for high cholesterol for 20 years, which is going to be worse. It's obvious. The 40-year period is going to be more harmful than the 20-year period. So a young person with high cholesterol also requires to control their cholesterol, because they're going to spend a lifetime with a high cholesterol and all its effects. Another common myth about cholesterol is that women don't need to worry about cholesterol. That is again not true. Incidence of heart disease in women is also increasing. And remember, women are protected from heart disease to an extent only till they are still menstruating. Once periods stop, the risk of heart disease among women rapidly rises till it equals men of the same age and then surpasses. So women also need to worry about cholesterol. And even women who are still having their periods, they cannot totally neglect their cholesterol. It may not be as harmful, but they are not 100% protected from heart disease or from high cholesterol levels either. And they should know their cholesterol numbers and, if required, take treatment. A third myth is that only overweight people have high cholesterol. Why? Again, weight has a role to do with cholesterol. There's no question. No, people who are overweight, especially those who are what we call morbid obesity, hugely overweight, their cholesterol levels are going to be very high and very difficult to control. But even thin people can have high cholesterol, because a huge component of cholesterol levels is genetic. So if you have a genetic tendency for cholesterol, even if you're thin, you can have high cholesterol. And even same thing, that there's this myth that if you're having if your diet doesn't contain fats, you will not develop a high cholesterol. That is also a myth. A higher fatty diet increases the tendency of getting a high cholesterol, but your main dominant predictor of cholesterol in the body is the body's own tendency. Again, that is genetic. So you can have a very low fat diet, your cholesterol can still be high. And if your genetics are favorable, even a high fat diet may result in a normal cholesterol. So while diet control is important for controlling cholesterol, it is not the only thing which will work. If your cholesterol is high, a very good chance that you are going to need medication. One myth which we again see is that if a health professional has not talked to you about cholesterol, you have nothing to worry about. That is not so. You may meet a health professional for a variety of reasons, and depending on what reason you are meeting them for, that is going to be their focus. It is not a common habit to talk about everything, because what your immediate problem is what is going to be focused on at that time. Eventual long-term problems, either you have to broach the topic or you have to go to a physician who deals with long-term problems, rather than a health professional who is treating you for some specific point, like say an ear infection or something, that you're going to go to a ENT specialist. He's not going to talk to you about your cholesterol. So you should take charge of your own health. At the end of the day, your health is is for your benefit, not somebody else's. You should take charge of your own health and make sure at least above the age of 40 that you know your cholesterol levels, your sugar levels, your blood pressure, everything. Ideally, it should be even at a younger age, but above the age of 40, definitely. So, yes, is that enough?